Well, June is National Headache Month, and whether you get them all the time or just once in a while, when should you get them checked out? Well, First News contributor Dr. Michael Savilla joins us now with some very good advice. It is hard to know. I mean, you don't want to be a complainer or a whiner, but you don't know when a headache is serious enough to start really pursuing, like going to a doctor and saying, look, I'm having these headaches. When do you know if your headache's becoming a chronic problem?
When I start to see them is when people take medication a lot, or they're saying, oh, well, I've used this over-the-counter medicine forever and now it's not working. Now I'm getting a little bit concerned. Or if they start to have a little bit more symptoms than a headache, then they get concerned.
Right, and that's what you should look for too. If it starts to be more than a headache, like what, being dizzy or other symptoms along with it, you may have a more serious problem.
Yeah, anything out of the ordinary other than the headache, you know, as far as like dizziness, blurry vision, numbness, tingling, those are things to be a little bit worried about.
And come in and see your doctor. Now, what types of over-the-counter medication should you start with, and then when do you know when to progress? Like if people have migraines, I know that they can get into other types of medications rather than just the migraine medication you get over the counter. How do you know the steps to take there?
Well, some people just grab whatever's on the shelf or whatever they have at home. People are very familiar with things like Tylenol and Motrin and those type of things. And there's also some branded type of medicines that say migraine on it, but sometimes it's the same medicine and sometimes not. But when people use that and it works, it's great. When it doesn't work and they start to have a little bit more symptoms, that's when they see me.
Okay. Different types of headaches we talked about. There's caffeine headache, like you said, when people are used to having caffeine every day, they don't have it, they get a headache. The migraines that everybody seems to be familiar with. What other types of headaches are there? Like stress-induced, those types of things? What other kind of headaches can people have?
Yeah, there's stress-induced headaches. There's a headache called cluster type of headaches that have a little bit different. Well, it's a little bit different symptoms as far as where the location is, what time of day it happens, how often it comes, and some other type of headaches. Some people get headaches associated with their periods, some people get headaches associated with allergies or sinus infections. So those are the different type of language that we use when it comes to headaches.
Okay. Best advice that you can give somebody, if they're going to come see their doctor, what do you want to tell them? Because I know you mentioned some type of journal. What do you want them to keep track of?
Well, something would be helpful to me is for people to write down as far as what triggers the headache. Sometimes it's a certain time of day, sometimes it's a certain food, sometimes it's a certain time of the month. Sleep, stress, what's going on in their life at that time, and some symptoms other than the headache. Are they having some dizziness, lightheadedness, blurry vision, those type of symptoms?
Right. If you write it all down and keep track of the days, then the doctor can look at a month's worth and see what's going on a little easier. So that's the way to go.
We try to find some patterns in the headaches that can definitely help us diagnose it.
Okay. Very good. Well, there's some helpful advice there. I appreciate you coming in. National Headache Month. We must have a reason. There are a lot of headaches out there.
That's right.
All right. Thanks, Doctor.
The Mahoning Valley Rib Burn-Off. Look at that, guys. We're cooking up some delicious ribs. We're going to tell you more about the event coming up.